Hi, good morning, everyone. Welcome to our Unit 4 discussion. Today we're going to be talking about the instruments and equipment sterilization and all that goes into that. So let's see here. What are our objectives for this week? We're going to talk about the difference between high and low temperature sterilization and how we're going to monitor that for quality assurance. Always, demonstrating principles of asepsis and talking about the different equipment that you're going to need to do this type of sterilization. So our assignments for this week include there's quite a few things actually, and one of them is a kind of a bigger research paper because it's worth 90 points. So make sure you are not procrastinating on that and getting that in because that's worth a good chunk of your grade. So, taking a 0 on this one will drop your grade considerably, okay? Just because of the way, the different grades break down and are weighted. So be careful with those. Make sure you're getting those in, and you're always going to have that discussion post. Make sure you're getting that first one in on Wednesday and responding to 2 peers by Sunday. Right? So let's get into it. Why is it important for central service techs to stay up to date on best practices? I mean, this is true of any healthcare professional that you have to stay up to date on best practices because things are constantly changing. Industry standards change, and they may find that maybe this way works better, this way is more efficient. So we need to make sure we're staying up to date on those things to maintain quality for our patients, making sure we're bringing the best to them. So an example I put here is the difference between flash sterilization versus something called immediate use steam sterilization, or IUSS. Back in the day, like back when I first started, we would call it flash sterilization. It's something that maybe an instrument is dropped in surgery. Maybe that's the only one. The surgeon needs it right then. They can put it in what we would call a flash sterilizer that the load only runs for 3 to 4, maybe 10 minutes, depending on the item. And then they could have it back quicker. Now, we changed the term to that to immediate use steam sterilization because people were basically abusing the system, so to speak. They were doing the flash sterilization more than they really should have, more than that was warranted. So they kind of changed it to something that was only needed for immediate use and not just because they didn't want to take the time to go through the whole process. So there were studies done on, the importance of making sure items were sterilized properly when when necessary. So let's talk about some of these point of use processing. So just like I just mentioned with IUSS, these are things that you only need for immediate use, and it has to be done again according to IFU standards because not everything can be reprocessed um, in that flash sterilizer, that immediate use steam sterilizer. Some things you just have to go through the whole process again. It's going to take a little while. If it's a lumen, if it's something like your Fraser suction or your metal yank hour, something with, a tube, a hole, those lumens have to be brushed and flushed out with a fluid so that you don't have anything built up from this case that you may have just been using it in, etc. So the steam penetrates the lumen properly. You also want to follow the manufacturer cycle times because something with a lumen is going to be processed different than maybe just a regular hemostat. Okay, I think I have a chart for those here in a minute. And then after it's steam sterilized, after it's gone through this IUSS process, you have to get it back to the OR safely without contaminating again. So you have to make sure you're transporting it in a way that's not going to recontaminate it. So whatever that casket is or process your facility has, make sure you follow that. So you're going to see AAMI a lot if you haven't already. That stands for the Association of Advancement of Medical Instrumentation, and they're really the ones that a lot of facilities are going to reference for their sterilization processes. This association has gone through, all the testing. They keep up to date with those things and publish those so your facility can reference them and adopt those processes. So most facilities, those are the guidelines you're going to be following. Okay, so what about the Joint Commission? What do they say? So remember, the Joint Commission is the facility or the entity, you could say, that accredits all healthcare facilities, hospitals, ambulatory centers, doctors' offices, all of them. So they also set certain standards that have to be met to maintain accreditation, right? So they have obviously things to say, right, about the whole sterilization process. So they want to make sure that everything is documented for traceability. So if something were to go wrong, they can come back, follow the paper trail, and see what happened. Obviously, follow proper steps and decontamination prior to sterilization, even if it's for immediate use. Um, they want you to follow the IFUs, and this is why it got changed from flash sterilization to IUSS. Lack of instrumentation is not an excuse. So just because your facility may simply not have a second one of those instruments, the surgeon needs it back, you still have to go through that process of complete decontamination, washer decontaminators, re-sterilizing, the whole thing. Just because you don't have that instrument doesn't matter. Okay. Here's also an important thing. If items aren't cleaned properly, they cannot be sterilized. So if you're not, brushing that lumen or whatever it is, you might leave something behind, which could render that whole sterilization process completely useless. So make sure they get cleaned properly. So here's that chart I was telling you about. These are the AAMI, like we mentioned, the minimum recommended immediate use steam sterilizer cycles. So this is for immediate use. And depending on the type of sterilizer your facility may have, it may change some of the times, okay? Also look at the load configuration because that's the different items. So your typical versus non-porous item, no lumens, like a hemostat, a Kelly, Koger, whatever. That's your typical clamp, retractor, no holes in it. So all of them are 270 degrees Fahrenheit, so that's helpful. And your typical hemostat would be 3 minutes. Now, if you start putting in something with a lumen or maybe plastic or rubber, it goes up to 10 minutes. It takes a little bit longer. Now, the pre-vacuum with a lumen, notice here, only goes up to 4 minutes as opposed to 3. So that's the difference here. So I would recommend either just memorizing this chart or making note cards. These are going to be common certification test questions for sure. Okay, so how do we check to make sure that the process worked? So what is this quality control, okay? We have to not just put the item in the sterilizer and hope for the best, right? That's not going to work. We have to have things in place to check the process, making sure the machines worked, etc. Make sure, we put in the right time for the item. So you're going to have things like physical, chemical, and biological monitors. They're going to be part of your quality control. We'll talk about each of those here in a minute. You also have a dynamic air removal test, or the DART test is another term for that, or the Bowie-Dick is also another name for that. And like Joint Commission said, record keeping, that way you can go back and see if something went wrong. Maybe a patient or a string of patients got surgical site infections. You could follow the paper trail all the way back to the sterilizer with the patient ID, sterilizer number, who ran the load. Maybe that's part of the problem. Maybe somebody needs retrained. Those are the things they're going to be looking for if there's an outbreak of surgical site infections. You need to check those things to correct it. Okay, so let's specifically talk about the high temperature sterilization, and then we'll get into low temperature in a minute. So the high temperature sterilization are things that can withstand high heat. Okay, so they can withstand high heat or even with the steam. So a steam sterilizer is high heat with steam. It is very effective, and the steam sterilization process is probably one of the most frequently used of all time because it's cheap, it's cheapest to do, and it's highly effective. So that's often what they're going to pick if they can do it on that particular item. So sterilizers kill all microbes, including spores. That's the whole purpose of sterilization, to kill microbes, including spores, because the spores are the hardest to kill. So in these high temperature sterilizers, typically you're going to use dry heat, or I mean steam type heat and not dry heat. So here are some advantages to the steam sterilizer because this is one of the most frequently used, right? The high temperature. So it is low cost and it's quicker than some of these other cycles that may take hours to run. Pretty simple technology, and because it's just steam and pressure and time, that those are the components. There are no chemicals that may be harmful to the the sterile processing tech, or may leave a chemical residue that could maybe potentially be cancerous. So you don't have to worry about that with steam, which is nice. So how is the steam sterilizer made up? What are the components? So that was a picture of it on the previous page, but you always have a jacket, which is the outer wall. Okay, it's insulated, pretty thick. You have a door gasket in the front, and then you also have a chamber drain, which notice the placement here. So the drain is usually near the front or the center of the floor on the bottom. So make note of that, okay? And then you're always going to have gauges and controls. You're going to see a control panel on the outside with monitors. It's going to tell you the time, the pressure that's, already in there if it's already running, and the parameters that the whole cycle is being run for. That way you can keep track. You're going to keep a record of it, or it'll print out a record. Sometimes it will print at the end of each load. So some types of steam sterilizers. There's not just one steam sterilizer. There are several, okay? So no, this first one is tabletop. If you're working in a hospital or, a big OR or something, you probably won't have the tabletop. This is the smallest of them all. So you're going to see those in clinics, offices, maybe even like tattoo parlors. That's something they would have. Gravity air displacement is very common. Actually, these three here in the middle are all pretty common. The gravity air displacement works because air is heavier than steam. So the steam will rise and then get through the entire thing, the entire inside casket. And you have dynamic air removal. So it's very similar to gravity, but in this one, you're going to have that vacuum removing the air. And then you need a slightly higher temperature than in the gravity displacement. So you're going to want to make sure you get those times correctly. And in the pre-vacuum steam sterilizer, you're going to have that Dart or Bowie Dick test ran daily to make sure that air is being removed properly. Okay, a steam flush pressure pulse is not as common, but it's going to have that steam flush alternating with air removal. Just works a little bit differently. And we talked about our IUSS. So these typically are going to be found in the OR, or maybe sometimes OR rooms have like a small room between each of them. That's called a substerile room. That's sometimes where you'll find them, or maybe in the core of the operating room, depending on the size of your facility. Okay. Notice down here it says saturated steam is required for all steam sterilizers. So you have to have steam. That's the whole purpose. And then the steam temperature is increased with pressure. So the more pressure you put in that container, the higher the temperature will go. So of the phases of steam sterilizers, it goes through 4 phases. So in this order, it's a conditioning phase, exposure time, exhaust time, and then drying time in most of them. So, it is a process, and sometimes that's why surgeons, don't want to wait the full cycle to get their favorite instrument back. Okay. They want to do that IUSS because it does take some time, but this is the most effective and guaranteed way to sterilize those types of instruments. So how do you load a steam sterilizer? This is also just as important in making sure that you do this correctly as not just making sure you have the right temperature for the right instrument, because you may have gone through all those previous processes and you didn't load it right, and the load's going to fail, and then you have to start all over. So you want to make sure you're loading it properly, because by doing so, loading it properly, it says ensures all surfaces within every item comes in contact with that steam. Now, if you overload it, you're going to have some areas the steam won't reach. Then it won't be sterile, won't be effective. So you want to package the item appropriately for the steam sterilizer, making sure you're using that right wrapper if it's a wrapped item. Leave spaces between packs. You're going to have more than one thing in the sterilizer, so leave spaces. Place hard goods on the bottom to prevent condensation from dripping because it is steam. There will be wetness during the process. Packages cannot touch the chamber walls. So not only do you have to leave spaces, you have to kind of like keep it on the inside too. This is a big one that fails a lot, is basins that aren't set on their side. Sometimes maybe they fell over. I don't know. If they fall over and like the basin part is upward, all that condensation is going to pool in that. It's like a bowl, right? It's just going to sit in the bowl. So you want them on their side to promote drainage, and you're going to stand up peel pouches like on their sides. So basically, when you're looking for causes of wet packs that came out of that steam sterilizer, things are wet, the load failed. What are you going to do? Okay, you're going to troubleshoot, but when you troubleshoot, always start with the most common causes, the most basic things. It probably had to do something with loading, the one we just talked about. Maybe a basin fell over, maybe you had things packed too tight. Check those things. Okay, have someone check your work if you're not sure, because you're going to have to redo it. And if you keep redoing it the same way wrong, it's going to keep failing. Okay. So always check for the most common causes here, and then work all the way down here at the bottom where it says boiler not properly maintained. That's probably your least likely cause for it to fail. So don't start there. Don't start calling maintenance because your load failed. That's not going to work. So check your wrapping, check your filters. Then you're going to start to look at the machine, the gasket, the valves, the gauges. Did something break there? Then you work that way. So start at the most obvious. Okay, let's talk briefly here about low temperature sterilization. So steam was one of the most commonly used high temperature. Now, if we have items that are too delicate or heat sensitive or even moisture sensitive, we're going to use a low temperature sterilizer. So these are three common low temperature sterilizers: ETO, which is ethylene oxide, and you have hydrogen peroxide gas plasma, or ozone. So ETO, or ethylene oxide, we just call it ETO, pretty often. It is effective, but the downsides and the biggest complaints about ETO is it's toxic. Okay, you have to be very careful when using ETO because the gases are toxic and it is highly flammable. And these gases, not just toxic, are cancerous. They're known to be carcinogens. So when you're handling these or around this, you have to be very careful. Now the H2O2, hydrogen peroxide gas plasma, is also, like, the commercial name for this is the STERRAD. And it is a little bit quicker and safer to use than ETO. So it's like sometimes your scopes and stuff might be placed in there. And then your ozone, in my facilities, we don't use ozone. We just don't. I think we have these two instead for our low temperature. But it doesn't require an aeration time. But gases can be toxic, but there are no true chemicals to handle. So that's an upside. Now we have to talk about biological indicators before we finish. So with each of these loads, to make sure that they're effective, you have to not just have a chemical indicator that shows the load went through the process. You have to have a biological indicator to show that sterility truly was met. That's the only way. Biological indicators are the only way to make sure sterility has been achieved. And the reason for that is because a biological indicator, here's a little picture, is like a little vial of a certain bacteria's spores. And you're going to place one of these vials in every load that you run. Or your facility may say every 12 hours or every 24 hours to make sure that machine is working properly. So each type of sterilizer has a specific type of biological indicator, or BI. Now this one says in this picture, biological indicator for the STERRAD sterilizer. So this is that hydrogen peroxide gas plasma, and it is called Geobacillus diarthermophilus. Isn't that a fun long word? Ozone also uses the same. The steam sterilizer also uses Geobacillus diarthermophilus. So this one's pretty common. You'll see that one a lot. ETO uses Bacillus atrophius. So it's just, with the most difficult spore for that particular sterilizer to kill. So you're going to put it in the load to run it, and then you're going to put it in something to read it, the biological indicator reader for this particular vial. Depending on the time, some of these can now be read in 3 minutes, or not 3 minutes, 3 hours as a rapid read. They used to take 24 hours for it to read, but that's not very beneficial. If you wait 24 hours for one of these, you've already given probably that instrument to a patient, and what if it failed? That patient just got potentially exposed to some sort of bacteria, something harmful. So it's not very effective to wait 24 hours. So a lot of companies are going to the rapid readouts, which is obviously better. You're going to always check if it turned, or your machine will tell you if the load failed. So you would pull anything that was in that load, so you don't use it. So biological indicators are very important to ensuring that sterility has been met. Okay. So that's it for this chapter, this unit. We are halfway through. We're already, at the end of unit 4, so keep up the good work. You guys are on the downhill slide now. So reach out if you have any questions or concerns. I do have office hours Tuesday, 1 to 3, if that works for you. If not, just reach out, okay? So have a great weekend. Bye.